Hello everyone, I am Sandra May Ibanyola from BSN 111A, and today I am going to demonstrate the eye assessment. So most of the people consider vision as the most important sense. So in this case, in doing the eye assessment, it will help us determine if a patient has an abnormalities in his or her vision. So now the first thing to do is to review the patient's medical record if available. Determine the scope of the assessment, for it is done for us to know the extent of doing the assessment, and of course prepare all the paraphernalia needed such as pen light, Snellen chart, a black ball pen, an opaque card, and the patient's data sheet. Prior to performing the procedure, I am going to close the door to ensure my patient's privacy and provide adequate lighting for patient's comfort. And introducing myself first to the patient as well as verifying her identity and explain the procedure that I will going to perform. And of course, let's not forget to perform first the hand washing. So, in order for us to be less at risk for any contaminations. Hello ma'am, good evening. I am Sandra May Ibanyola, your student nurse for today. Please state your complete name.
Princess Diane Erolon.
Your birth date and civil status, please.
January 6, 2004, single.
Okay, thank you very much ma'am. But before checking your eyes, may I ask, what should I call you?
Diane.
Okay, Ma'am Diane, but before conducting the eye assessment to you, there are some specific movements that I need you to follow, and there are some specific angles that need to be tested if you can see in the light or dark. Is that okay with you?
Yes.
Okay, but before we proceed, do you have any clarifications or questions?
And so far.
Okay, so we'll start first with the visual acuity. In assessing my patient's visual acuity is to check if there is any visual aids such as wearing of glasses or lenses so that the patient can use it during the test. But if it's considered as reading glasses, I need to tell my patient to remove it for it can cause of blurry vision. So now, Ma'am Diane, may I ask if you're wearing a corrective lenses?
No.
Alright, so I had the patient the need to stand 2 feet away from the Snellen chart and cover her eyes with the opaque card, as well as asking my patient to read the letters written in the chart until she can no longer determine the letters written in there. So Ma'am Diane, kindly please stand over there. I need you to cover your left eye with this opaque card and start reading the chart.
E, F, P, T, O, Z, L, P, E, D. P, E, C, F, D. E, D, F, C, Z, P. F, E, L, O, P, Z, D. D, E, F, P, O, T, E, Z. L, E, F, O, D, P, C, T.
Alright, next please cover your right eye and start reading the chart again.
E, F, P, T, O, Z, L, P, E, D. P, E, C, F, D. E, D, F, C, Z, P. F, E, L, O, P, Z, D. D, E, F, P, O, T, E, C. L, E, F, O, D, P, C, T.
Okay, I'm gonna need the opaque card please. And now that your eyes are both uncovered, please read the chart again.
E, F, P, T, O, Z, L, P, E, D. PECFD, EDFCZP, FELCPZD, DEFPOTEC, LEFODPCP.
Alright, so the doctor reading is the left, right, and both eyes. So, I need to document the readings of each eye and both eyes, as well as performing another vision test such as light perception, hand movement, and counting of the fingers until she's unable to see the top of the Snellen chart. But first, I am going to perform the hand movement. So, Ma'am Dayan, I am going to perform the hand movement, and kindly please tell me the direction or where is it pointing. So, let's start.
Upward, downward, left, right.
Okay, I'll proceed with the counting of fingers.
5, 3, 1, 2, 4, 5.
Alright, so kindly please sit for a while as I'll proceed with the light perception. So kindly please tell me where is the direction of the light. So let's start.
Downward, left, upward, right.
Alright, thank you for that, Ma'am Dayan. So that's the end of my patient visual acuity. In testing the visual fields, I will face my patient directly at a distance of 60 to 20 centimeter and instruct the patient to look directly at the examiner's eyes, which both hands will be 2 feet apart lateral to the patient's ear. For areas, the moving fingers will be moving onto the imaginary bowel or hole for the upper and lower quadrant or the temporal quadrant until the patient identifies it. And of course, ask my patient to tell me if she can already spotted my moving fingers. Alright, we're done testing your visual acuity. Let's proceed to testing your visual fields. So now, Ma'am Dayan, I need you to tell me if you can already spotted my moving fingers. Let's start.
Yes. Yes. Yes.
Okay, let's perform another, but it's a single hand moving finger. So let's start with your right eye.
Yes. Yes. Yes.
The other eye.
Yes. Yes. Yes.
Okay, thank you very much for that, Ma'am Dayan. If you detect a defected area, slowly wiggle your fingers onto the defected area and repeat it again until the defected area will be defined, and check for the other eye of the patient for any accompanying defect. But in my case, I don't have or don't see any defected area. So, in the visual inspection for the eyes, it is basically or simply visually inspecting the patient's eye for alignment and symmetry. So now, I'll be inspecting my patient's eyebrow in regards for her hair distribution alignment, the skin quality, and movement. So now, Ma'am Dayan, could you scoot over here a little bit? For I will be inspecting the hair distribution. Okay, it is well distributed, as well as the skin quality around your eyebrow is okay. So now, in assessing your movement, I need you to do this. And this. Okay, thank you. So now, I'll be inspecting the patient's eyelash, the evenness, and the curve. Okay, your curl is slightly upward. And now, I'll ask my patient to close her eyes for I will be inspecting her eyelid surface. Okay, so I don't see any skin discoloration. And now, I'll be inspecting for the lower lids. So, don't forget the area around over the lacrimal gland or lacrimal sac for swelling. So now I need to ask my patient to look up in order for me to assess the sclera and bubular conjunctive. Okay, so let's proceed with the eyelids to perform the cerebral conjunctive. So let's use a mini cotton pads. Another eye, please. Okay, thank you very much. So that's the end of the visual inspection for the eyes. So now we're done for the visual inspection for eyes. We will proceed to assessing the direct and consensual pupillary reaction to light. To inspect for the iris, pupils, as well as for the each corneas and lenses carefully with the opacities, clarities, and texture. In order for me to do that, I am going to shine this pen light and ask my patient to just look at me straightly or directly. So, now Ma'am Diane, we're done doing your visual inspection for the eyes. We will be proceeding to assessing your direct and consensual pupillary reaction through the oblique position and shining this pen light through your pupil. Is that okay with you?
Yes.
Okay. Okay, you have a brown cornea and I don't have noticed any opacities. To assess the direct and consensual reaction, darken them partially and ask the patient to look at a distance. At the same time, shine this pen light through her pupil. Take note for any direct and consensual reaction. Okay, Ma'am Diane, I am going to turn off the lights and I need you to continue looking at me straightly. So that's the end of the assessing my patient's direct and consensual reaction, pupillary reaction. So now we're done with the direct and consensual pupillary reaction. Let's proceed to assessing the accommodation. In assessing the accommodation, it means that assessing each pupil's reaction for accommodation. I will just hold this pen light 10 centimeters away from my patient nose bridge and ask my patient to focus her gaze in the top of the pen light and alternate her gaze from the back of the pen light's object. I will also instruct my patient to alternate her gaze from near to far object and observe for the pupil's reaction. So now, Ma'am Diane, I need you to focus on the top of the pen light. From the back of the pen light's object, from the top of the pen light, and from the back of the pen light's object. Okay, thank you so much. I will perform another movement and observe for the pupil's reaction. Okay, Ma'am Diane, I'm going to bring this pen light towards your nose bridge and focus your gaze only from this. Okay, let's start. Okay, so that's the assessment for the accommodations. So now we're done performing the HIRSCHBERG test from about 2 feet directly in front of the patient. Shine onto the patient's eyes and ask the patient to look to it. So, Ma'am Diane, I am going to shine this pen light in your eyes in order for me to see the reflection of it in your cornea. Is that okay with you?
Yes, nurse.
So, I will inspect for the reflection as well as for any direct and consensual reaction. So I was just trying this pen light 2 feet away from you, and let's observe if your both eyes will react equally. So now we're done with the Hirschberg test. We will be performing the cardinal field of gaze test, or the extraocular muscle test. In assessing the extraocular movement, we will be looking for the normal conjugate in every direct, or to look for jerky movements in the nystagmus on the lateral gaze or upward gaze. Okay, now, Ma'am Dayan, I need you to look and follow the tip of the pen light as I will make a letter H in the air without moving your head and neck. I will be watching the rim of the sclera and the iris whenever the eyes moves up and down. So, let's start. Okay, so far it's good. So, we're done with the cardinal field of gaze test. So, to test for convergence, I'll ask the patient to look at the pen light as I move it towards her nose bridge. And, of course, to observe for any convergence. Okay, Ma'am Dayan, we're down to the test for convergence, which is the last test for the eye assessment. With that, I need you to follow and focus your gaze with the pen light as I move it, and I will observe for any convergence. Okay?
Okay.
So let's start. Okay, so far it's good. To summarize, and the findings is the last thing to summarize all the informations that obtained during the working phase. To discuss the findings and plan for the possible healthcare concerns if present, assess patients' understanding for further health teaching, and of course, to provide my clients an opportunity to raise any concerns or questions. So, Ma'am Dayan, do you have any questions or concerns to ask?
No, none so far.
Okay, so Ma'am Dayan, in assessing your eyes, it shows that your visual acuity is your right eye is 20/25 and your left eye is 20/30, and both eyes has 20/20, which means it's good and normal. In regards for the testing the visual fields where I was wiggling my fingers, your upward field is at 50 degrees, downward field is at 70 degrees, and your nasal upfield is at 59 degrees, which is considered still as normal. So for the inspection of the eyes, your eyes is aligned and symmetrical. The eyebrows are very distributed and arched. The eyelashes are evenly curled upwards, and for the eyelids, there's no skin lesions or any signs of skin lesions. For areas, the lids close symmetrically and you have a normal frequency of blinking. In terms of palpating your lacrimal gland and sacs, there's no signs of edema or swelling. Sclera is white and normal, and your conjugate are good, as well as the iris and pupil are normal with no opacities. Your pupil's response during the accommodation is also normal, and in terms of cardinal field of gaze test, is both eyes are performing coordinated and no jerky movements. So all in all, your eye assessment is normal and there's no actually a problem in your eyes. So thank you so much for your cooperation.
Thank you, nurse.
Okay, thank you, ma'am. So prior to the procedure, I am going to perform a hand washing in order for me to wash off all the contaminations that I had during the assessment. So, let's start.